If you think the only solution to blurry vision in middle age is to wear reading glasses, there's something brand new out there, an eye drop that improves near vision. Dr. Nikhil Wagle from Eye Surgeons Associates is here with this brilliant idea, doctor, which it sounds like some kind of magic miracle or something.
It's been a long time coming.
So so I don't need to wear readers at all if these drops work for me.
That is correct. It's mainly meant for people who have mild to moderate presbyopia. And presbyopia is it's a chronic disease. It happens in everybody. In fact, it happens to about 128 million people right now are currently suffering from it in the United States alone.
At about the age of 40 is when this happens. That's when you can't see close anymore.
Right.
So you just saw that picture of the drop, which is called Vuity.
Vuity.
So this is something I need to use every day in order to see better close up?
If you want to be without or try and reduce your need for the reading glasses, then yes, you should be using it every day. Sometimes it gives people another option, though, where sometimes they don't mind wearing the reading glasses, and other times they're like, hey, I want to go out in the evening and I want to carry around these reading glasses, and you can put a drop of Vuity in, and then you don't have to necessarily be dependent upon those.
Well, this video shows that we still need to go to your office in order for you to see if this is right for me, or how will you assess that for your patients?
Correct. So the interesting thing is we like to assess if you have mild, moderate, or severe presbyopia, because this works mainly for people with mild to moderate presbyopia right now. That's what it's indicated for. But as with all medicines, there can be side effects. This medicine, although in the studies there was nobody who ever developed any terrible ocular side effects, this is a medicine that we've known about for the last 25 to 30 years because we've used it in other arenas in ophthalmology. And in higher strengths, it did cause some retina issues for some people. So just to be on the safe side, we like to do a full eye exam to make sure people's retina looks okay, and then to make sure they have no other eye diseases that would cause this medicine to be contraindicated in them.
Okay, so could your older patients who are into advanced age may use this as well?
Well, we don't know about that yet. It has not been studied, and most of the people in those advanced ages are in the severe type of presbyopia, because presbyopia is, as you mentioned, an age thing. So when people get into their early 40s, they usually have mild presbyopia. When they get into their late 40s or early 50s, it becomes moderate, and then probably by late 50s, early 60s and onward, it becomes severe.
Okay. So you don't know about your people of an elderly age about whether they could do this?
That's correct.
Okay. So the other thing I'm thinking about, doctor, is someone like myself. I've worn glasses or contacts nearly all my life. I have astigmatism, and I can't see near or far. So this would be good for someone who has overall poor vision, or really is it only treating the near vision, the reading vision? So
it's meant to treat the intermediate and close-up vision. And in most people, when they use it, they won't have their distance vision affected. So let's say somebody wears they wear contact lenses for distance. They would put this eye drop in. After about 10 minutes or so, they would put the contact lenses in. It would most of the time not affect their distance vision, and they'll need the contacts for the distance part, but then this eye drop would work to help with their closer up.
Is it very expensive for the consumer, for a patient?
So since this is considered not medical, it is a cash pay medication. And right now it retails for about $79 at the pharmacy. So
you're saying insurance would not cover it?
That is correct.
Because it's non-medical.
Correct.
And how long would a bottle last, do you think?
So a bottle would last, if you used it every single day, it would last a month.
Okay. So I like what you said, though, about maybe for a special occasion, like you're going out or something, or you don't want to fool with your readers today. So the drops will last me for a day?
Usually it lasts about 6 hours for sure, for most people. And then over time, after like the 8 and 10 hour mark, the effect does wear off. But it lasts for a good solid 6 hours in the studies.
All right. Prescription only. So I come to you and you have to write me a script for it?
Yes, you need a prescription for it.
So are you excited about this? You think this will kind of change the landscape for a lot of folks?
I think it will, because Paula, as you probably know, in the last 20 years, things have changed with regards to our intermediate and close-up vision, especially intermediate. 20 years ago, we weren't as into computers, not into our cell phones, and when I was first started in ophthalmology, we always talked about how important distance vision was and then how important reading vision was.
Yeah.
We kind of didn't have much for the intermediate. But now, in the last 25 years, our life has changed where this intermediate vision is so important. So if we can try and make people less dependent upon having to put glasses on every time they want to look at their cell phone or look at their computer, this gives people an option. And so that's what's so exciting about it.
That is a very interesting point. You're right. Before it was just you were reading right here, or you were looking to drive. But now you're right, where the computer sits on your desk, or where you hold your phone, or your iPad, or whatever.
And I'm suffering from this as well. So in the morning when I wake up and I have to try and look at my cell phone in the morning first thing, it's difficult for me and I get very frustrated. So I can totally understand why many people would like this as an option. And in fact, 90% of people who get above the age of 40 start to become frustrated with
90%, I know.
With their close-up vision.
Even if you're like myself, I've been nearsighted all my life, but then when I hit middle age, I couldn't read close either. So that's, I needed everything. So have you tried the drops?
Yes, I have.
Okay, what do you think?
And I liked it. I am a little outside of the range of who they studied it in. So for me, for the first 45 minutes, my distance vision was just a little bit blurry, but it wasn't bad. But after about 45 minutes, my distance vision was fine, but my intermediate vision and near vision was just wonderful. And so the only thing to really be careful about with this medication is that about 15% of people, when they first start using it, they might get a little bit of a headache, but most of the time it's very mild and it's transient, and if you use it repeatedly, the headache really doesn't seem to recur.
Dr. Wagner,
now, my wife uses it every weekend when she wants to read the paper in the morning when she wakes up, and she says she doesn't have to wear her glasses at all. So she'll read several newspapers in the morning. She puts a drop in the first thing when she gets in the morning, and she is perfectly fine for that whole morning and afternoon.
A little Wagley, yes, personal perspective there.
Exactly.
Thank you, Doctor. Good to see you. Eye Surgeons Associates is where you need to go for all of this in Rock Island and Bettendorf.